All right, picture this. You're on your surgery rotation, making rounds. You walk into your patient's room, they're post-op day 2. You glance at the vitals there it is, a temp of 101.5.
And of course, your attending looks right at you and asks, "What do you want to do?" Suddenly, your mind is racing, right? Could be an infection, could be something else entirely. Look, a post-op fever is super common, but you can't just brush it off. So you're at the doc. What's your move? How do you even begin to untangle this?
Well, don't sweat it, because there's an amazing mnemonic that cuts right through all that chaos. Salam, and welcome to A Little Push. Today, we are going to break down one of my favorites, the 5 W's of post-operative fever.
And listen, this isn't just some random list you have to memorize for an exam. No, you got to think of this as your actual diagnostic roadmap. And here's the brilliant part. The 5 W's are laid out on a timeline. This helps you figure out what's most likely based on when that fever pops up. It's a total game changer. So let's get into it.
Okay, so our first W is wind, and that's all about the lungs, pulmonary stuff. If your patient spikes a fever in those first 48 hours after surgery, this is where your brain needs to go first. No question.
So yeah, we're looking right at the very beginning of that post-op timeline. See, this super early fever, it's usually tied to the lungs, just, recovering from the whole ordeal of anesthesia and surgery. The main thing we're worried about with wind is something called atelectasis. That's just a fancy word for when the tiny little air sacs in the lungs, the alveoli, kind of collapse on themselves. And honestly, this is the #1 cause of that early post-op fever. The trick is to catch it before it turns into a nasty pneumonia. So how do we do that? Simple. Get your patient up and moving, tell them to take deep breaths, and hand them that incentive spirometer. It really works.
All right, let's move on to our second W. So once you're past those first couple of days, if a fever suddenly shows up, you got to shift your thinking a bit.
We're now in the territory of post-op day 3 and beyond. And this is when the chance of a urinary tract infection, our water, really starts to climb. And what's the usual suspect here? Yep, the Foley catheter. The longer that thing stays in, the higher the risk for a UTI. It's just a direct line for bacteria. That's why your first move should be the easiest one. If they don't need it, get that catheter out. After that, you'll want to get a urinalysis and a culture to confirm what's going on. Next up, our third W is walking. And this one is all about the risks of just lying in bed after surgery. We're talking about blood clots, specifically a venous thromboembolism.
So the classic time frame for a deep vein thrombosis, or a DVT, to show up is a little later, usually around post-op days 5 to 10. It makes sense, right? This is when blood that's just been sitting around in the legs because the patient isn't moving, well, it can start to clot up.
And you've got to know the classic signs. Look for unilateral, meaning one-sided, leg swelling. The leg will often feel warm to the touch, and it might look pretty red. If you see that combo, your very next thought should be to order a lower extremity duplex ultrasound to check it out.
Okay, so from the legs, let's bring our attention back to the star of the show, the surgical incision itself. And this brings us to our fourth W, wound.
A surgical site infection, or SSI, usually makes its appearance around post-op days 5 to 7. Now, you might notice that timeline overlaps a bit with a DVT, right? And that's exactly why doing a really good, thorough physical exam is so important.
So what exactly are you looking for at the wound site? Well, you're looking for those classic cardinal signs of infection. Is there redness, what we call erythema, spreading out from the incision? Does it feel warm? Is it swollen or draining pus? Does it hurt? You got to ask all those questions. And hey, if you're worried about a deeper infection, like an abscess hiding under there, you're probably going to need a CT scan to really see what's happening.
And that brings us to our fifth and final W, which is kind of the wild card of the bunch, wonder drugs. This is the one that can cause a fever literally any time after an operation.
The thing to remember is that unlike all the other W's, a drug fever doesn't care about the timeline. It can happen on day 1, day 10, whenever. So it has to always be on your list of possibilities, from the moment they're in the OR until long after they've gone home.
Now within this wonder drug category, there's one diagnosis that you absolutely, positively cannot miss. I'm talking about a true life-or-death medical emergency, and it's called malignant hyperthermia.
So what is it? It's a really severe reaction to certain drugs they use in anesthesia, like succinylcholine, and it usually happens right there on the operating table. the very first clue might just be a rising end tidal CO2 on the monitor. Then you get hit with the classic triad: hypercarbia, tachycardia, and really intense muscle rigidity. On top of all that, their temperature just shoots through the roof.
And you have to know the antidote. You stop the drug causing the problem, and you immediately, and I mean immediately, give them dantrolene. It's life-saving. Okay, you made it through the 5 Ws. Let's do a super quick quiz to make sure this all sticks. You ready?
First one, you have a patient with a brand new fever, and it's post-op day 1. What's at the top of your list?
You got it. It's wind. Almost certainly atelectasis.
Okay, number 2. You see one-sided leg swelling on post-op day 7. Which W is that, and what test are you ordering right now?
Yep, that's walking, because you're worried about a DVT, and you're ordering that lower extremity duplex ultrasound. Perfect.
All right, last one. This is the big one. Your patient in the OR suddenly gets super rigid muscles and a crazy high fever. What is it, and what are you going to do about it?
Yes, that's Wonder Drug, specifically malignant hyperthermia. And the treatment? You're giving dantrolene stat. Awesome job. See? This mnemonic is so much more than just something to cram for a test. It's a real-world clinical framework that helps you think clearly when things get confusing. Seriously, if you master these 5 Ws, you'll walk onto that post-op floor with so much more confidence.
So what other high-yield mnemonics do you want us to cover? Drop your suggestions in the comments below. We really do read all of them. Until next time, salam.